Hi folks, just here for this week's video to talk about assessment. I am going to start by discussing chapter 2 out of Skinner's text. In particular on page 37, I just want to talk about these bullet points here. He talks about what an assessment basically involves and what its objectives are. At the bottom of page 37, he says, to precisely identify the disorders or the clinical diagnoses. Two, estimating the severity of individual characteristics of these conditions. So I want to know if a person's on where they fall on the spectrum or on the continuum of whatever individual clinical diagnosis they experience. So how severe is the problem, basically? And to determine a person's particular needs and appropriate treatment approach. So does the person need to be a part of a support group? Do they need outpatient care? Do they need inpatient care? And lastly, he points out assessing for additional problem areas that can affect treatment planning and effectiveness. So the person's physical health, occupation, housing, social support, legal issues, family relations. Um, I think it's really helpful, and the danger can be for experienced clinicians to skip this step in some ways, to do a brief assessment, to leverage your experience, to maybe project onto the client what you think you see. And that can lend itself to certain black holes that may be creating the problem that the person is dealing with in the first place. So the other thing about assessment is that important aspect of determining the appropriate treatment. So when I worked up at De Novo, one of the things that we really improved and changed was our screening and assessment tools for the client prior to them arriving. We would have been several hours north of Toronto, and often the client and or their family members or support workers really want to get them into treatment, and anywhere will do on some levels. So what we had to do is make sure that our skills that we possessed were a good match for the person who was coming up. Because once they cross the threshold of your agency's door, particularly if it's a residential treatment center, you're then therefore responsible for that person. And in our particular case, severe mental illness would be something that we could not work with. We could work with anxiety on a certain level. We could work with depression on a certain level. Um, and we could work with some aspects of a person having poor short-term memory or forgetfulness or different characteristics that might be drug-induced. So, but a person with schizophrenia, a person who was hallucinating, would not work in the group setting that we ran. So it was important to not have that person come up and have all the energy it takes to bring a person to treatment, to make sure that we properly assessed it. We owed it to that person that we were going to set them on the best path for success if they in fact came up to de novo and we were accepted them. So the other thing is it takes a tremendous amount of energy if you've misassessed a person and you put them in a particular program. It takes a lot of energy to redirect them to the appropriate fit. So you want to get it right the first time. That's primarily what I would say about my working experience with assessment. Um, so I think that'll conclude today's this week's video. I would follow through with the readings; they're very helpful, and feel free to ask any questions if you have any. Thanks so much. Bye bye.